Greetings, this is a coronavirus COVID-19 update for 3/12/2020. And we start with Baidu, which is a Chinese search engine to grab all of the Chinese numbers and stories. So the key number here is the cumulative diagnosis down on the lower left, 80,987. And by the way, this data hasn't been updated to show increases or decreases from the day before. And this was taken at 10 o'clock in the morning on the 13th China time, which is their deadline, and it still wasn't there, a couple hours later. So I don't know what the problem is. There's a when you see these numbers in here like this and they don't have the changes from yesterday, there's what I grayed out down there. The changes from yesterday are done after the National Health Commission approves them. So for some reason, they were busy doing something else. Then we see the maps. If you scroll down further, and I was going to put a big map of the new map in the middle here, but it never appeared. So China's showing here, they changed these maps just maybe 4 or 5 days ago, and now they show cumulative cases minus recovered cases. So as you can see, all the provinces in China from the map on the right to the left are getting lighter and lighter colored every day using the same legend that they always used on the lower left. So Hubei province is still the only dark province. You can see down south, Guangzhou province, which is just above Hong Kong, most populous province in China, with Guangzhou and Shenzhen, two giant cities, and Dongguan, also a pretty good-sized city. So that province on the lower, you could see in darker red on the two right maps, is now light-colored. So recovery is all over China. Then this is the same graph as yesterday. This is the graph number 1 that plots, all these items on the same graph. New diagnosis was 25. I don't know what new diagnosis for today is because that number is not out. And this is the graph number 2, which plots non-Hubei province and Hubei province and the combination of both of them, which would be the national number, and that number is not out for the 12th. And this is the third map that China just added a few days ago, that plots new cases in the rest of the world against new cases in China, and just to show you how China's outperforming the rest of the world now. 1.3 billion people, they only have 25 new cases. You'll see later what the rest of the world is doing. Then this hasn't changed either. I'm just keeping these screens so I can add good screens in there tomorrow. And this map I don't use because it's not accurate. And then if you scroll down further, this is something we can use that doesn't have to be updated per day, because these are stories that just accumulate during the day. These are hot search today, which means these are search terms. And sometimes the search terms don't make sense because they're searching for a story, and sometimes the way they search for a story would be like any other people that use various search terms. So anyways, the top search in Baidu is for the dynamics of the coronavirus, and that's number 1 every day. And that's the numbers that we tried to show you, but they're not updated for today. Actually, the numbers are updated. The change from yesterday is not updated. So we don't know if the numbers are actually right. So there's 4 stories in here that I'll cover. Yesterday I did all of them. But today, there's some things in here just not worth looking at, like the White House temporarily closed to the public. Big deal. And Mitchell is a NBA player, so we'll skip that. Canadian Prime Minister Trudeau and his wife are self-confining themselves because his wife tested positive. So they're going to be staying inside for 14 days. So let's take a look at the rest of the story. Number one, we have an expert in China saying that the epidemic is expected to end in June, and it looks that way because everything's going down every day in China because they're taking drastic measures. China screwed up at the beginning and infected the rest of the world and let their country go crazy with rampant infections, but they fixed things since then, and the United States has not. On the right, Italy will build Milan version of Vulcan Mountain. This was a really huge gymnasium, or actually is a convention center in Wuhan. It's similar to the Wuhan hospital built in, or Vulcan Mountain Hospital built in Wuhan. So this was a huge place in China, and it just shut down a couple days ago, and it was in my video yesterday or the day before, where the news story from that is that the people that worked there, all the doctors and nurses, took off their masks for the first time because it was shut, and for the first time they saw what each other looked like. So it was kind of interesting. Then the next story, Manila, capital of the Philippines, is shut down. And on the upper right, this is kind of a crazy story. I looked it up in 4 or 5 different news services from China, and it's just a gathering of a bunch of people, over 100 people on a basketball court, and nobody really quite knows what they were doing there. Probably they use social media. A lot of times Chinese people will gather and they'll use social media to say, hey, we're going to meet here, and they semi-protest something. But nobody could figure out why these people were gathering here, and officials came in and dispersed the crowds. That was the end of the story. Then we have the Johns Hopkins Global Tracker, which is the Center for Systems Science and Engineering. That's a research institute at Johns Hopkins University. And we're looking at a number today, 128,000 infections globally now, 4,700 deaths. And the first thing I do is take a look at this compared to the Chinese number, but that's maybe not updated, maybe it is, and it's pretty close to what we show anyway, so it doesn't impact the total confirmed that much. And then I look at the hotspots, the global hotspots outside of China, which are really the hotspots in the world now. So Italy, that number wasn't changed. I just refreshed this, and I don't know why the number for Italy hasn't changed. Italy hasn't released any new cases today, any numbers. Iran from 9,000 to 10,000. South Korea, they basically have things under control. 7,755 to 7,869, so increase there of 300. But the numbers, actually that's big for them in the last couple days. And then the deaths, 827 from Italy, not updated again. In Iran went from 354 to 429. South Korea 60 to 66. And we'll take a look at the stories that impact these 3 hotspots. First from Italia. So we have on the upper left, Conte closed, Prime Minister closed bars and shops, food shops and pharmacies. That's actually news from yesterday. And the one in the middle here, this is kind of interesting. So let's hit the upper right first. After thousands of deaths, 1,258 healed, 213 more. And on the lower left, let's see, Italy is saying we need help from the rest of Europe. Don't hinder us, help us. But that's an article basically about the stock market, and everybody's stock market took a hit. So the lockdown now in Italy, this is the most interesting news that I found, was the 12 answers for rules in the lockdown. 1, can I move around in Italy? You cannot leave the house except for valid reasons. What are the valid reasons to leave a house? To go to work, health reasons. To prove the need to leave the house, you have to, you have to fill something out and keep it with you and show people that if they stop you. Who is outside your home? This is translated into English, so it's kind of broken English. In other words, if you are outside of your home, can you return back to your home? Yes, you can. If you live in a municipality and work in another, can I go back and forth? Yes. Can I use public transport? No, it's shut down. Is it possible to go out and buy food stuff? Yes. If you exit to purchase goods other than food, only if strictly necessary, yes. Can you go eat with relatives? No. No public gatherings, not even with your relatives, not even small groups. Can I go to assist my dear seniors if they're not self-sufficient? Yes, you can. Is allowed to do motor activities outside. They mean activities outside. In compliance with the interpersonal distance of 1 meter. Yes, you can. You can go outside and exercise or jog or whatever you want, but 1 meter away, you have to stay away from other people. Can I go out with my dog? Yes. What happens to those who do not respect, the limitations? 3 months possible in jail and €206 fine for some reason. So that's what's going on in Italy. In Iran, same old stuff. Iran's, yesterday we looked at the upper left video. I'll put yesterday's important thing in the upper left if there's room for it. So this was a video that a guy made walking around Iranian hospital and see people wrapped up in sheets, dead people, and the video went on to show people in black body bags, and then it showed people in funerals. So, Tehran Times, they're calling for anti-Iranian sanctions to be lifted from the U.S. And Iran's special case on the right, sanctions, media war, coronavirus. They want the sanctions to be lifted from the United States because they're using that as an excuse. They can't get the stuff that they need. Iran fails to take timely measures on the lower left. Yeah, that was the problem because Tehran, all of the issues in Iran started at one city. I forget the name of the city. But it's a religious pilgrimage, and the leaders in Iran were saying, even after people started coming down with coronavirus, they said they don't want to keep people from making their pilgrimage to that city because a lot of people were coming from other countries and they're making a lot of money off of that. But they're staying at the same hotels and the same hostels, and they're eating in the same restaurants, and they're confined in really small quarters because it's really uber crowded during this pilgrimage, and they all infected each other, and that's what happened here. So it's their own fault. Coronavirus burial pits so vast they're visible from space. So we don't think any of the numbers coming out of Iran are correct. 10,000 people infected, and the deaths go up every day, and the reason that nobody believes that is because people from inside Iran are reporting that it's much worse than what they're saying. So let's put a little statement in here. Iran sent a state-sponsored army general to Iraq to help militants attack the U.S. embassy, and then the U.S. killed him at the airport with really cool little super accurate missiles that entered both cars, destroyed the cars, and didn't do any damage to anything else. So the U.S. basically assassinated this guy. Why? Because he is he is sponsored by Iran. He's their leading general. He's a national hero. He goes to Iraq just to help militants attack the U.S. embassy. So we killed him. Then Iran shot down a commercial airliner. Okay, that's why you're in this predicament with the sanctions. If you can build nuclear reactors and buy Russian missiles, then you can make virus masks and disinfectants or buy them from Russia. Okay, the world doesn't need to stop the sanctions against you. The sanctions are there. And again, Americans do not hate Iranians. We hate the same people that Iranians hate, and that's Iran's leaders. Go to any university. Ask a university student. You've seen videos of university students protesting for a month after they shot down that plane. They just don't like Iran's leadership, and that's shooting down the plane isn't the only reason. It's the crazy rules that they have, about what you can do and what you can't do. There's no freedom in Iran at all. Okay, what do we have next? South Korea. So, upper left, the old story. South Korea sees more COVID-19 released than new infections. That's really good. And then on the lower left, from Forbes, China and the South Korean models seem the only way to contain COVID-19. So even, actually South Korea is the ideal model. Because why? Because China screwed up at the beginning. And they screwed up, in the middle too. At the beginning, they locked down Wuhan because of all this coronavirus stuff going on in this seafood market. And they closed the airports, but they didn't close the trains or the roads, and 500,000 people left Wuhan out of a city of 11 million, and they went around the world and infected everybody else. And then later, when China did something good by sending in the army, to help, with army medics and nurses and, to help with the situation in Wuhan. And then it came out like a couple weeks later that, 1,700 health care workers were infected, and then it went up to 3,000. So China has made a lot of mistakes on the way that other countries can learn from, and that's what South Korea is doing, learning from their mistakes. So South Korea started locking down a lot of cities, and they announced today that they're using, South Korean experts recommend using anti-HIV and anti-malaria drugs for COVID-19. So before this really got out of hand in China, China asked the United States for some drugs, and the U.S. says, okay, we're going to send you some, AIDS drugs and a bunch of other drugs. And they also sent some people from the CDC over there. So now Korea is saying that the Korean Society of Infectious Diseases, Korean Society for Antimicrobial Therapy, Korean Society for Pediatric Infectious Diseases, and Tuberculosis Association all got together and published this. And they said Kaletra, an anti-HIV medication that includes the drugs lopinavir and ritonavir, those are both the American drugs that were first given to China, and China had a lot of success using them. And there's another American drug that's newer than either one of these that we used on our first patient who was nearly dead, and that patient recovered the next day. So anyways, these are both this brand name Kaletra. I'm not sure if that's how you pronounce that. But that's made from AbbVie Labs, AbbVie Incorporated, which is a spin-off of Abbott Laboratories. So Abbott Laboratories developed these other two drugs, and they set up this new company, AbbVie, which has been around for a long time. I've been studying this for a month now, or since mid-December. And AbbVie is the one that's cranking out these drugs for people to use. So that's an American drug. Now why can't the US follow the South Korean lead? We're probably using these drugs with our patients, but we're not doing anything else to contain the virus. So next we have, outside of the three main hotspots, we have France, Spain, Germany, and then Norway, and then we'll get to the US later. So Norway is a new name popping up here. They went from 600 to 700 cases. France, some of these numbers aren't updated from yesterday. Germany is, and I don't know what's lagging with the numbers. It's crazy. There's no numbers coming out of China, and then this, Johns Hopkins Research Institute, they don't have updated numbers for France and Spain, same as yesterday. So anyways, we'll get to the news. Coronavirus, upper left, is France's greatest health crisis in the country. They have a living room where some French people are watching Macron. And then the Connection, which is a French publication, schools across France to close from Monday. So that's what's going on in France now. They're taking some measures to keep people from contaminating each other. From Spain, which is in the orange, coronavirus lockdown, first 4 towns are quarantined in Spain. So 4 towns are a complete lockdown, no coming and going. And they also announced today for residents of Madrid that they urge people to stay at home in Madrid. But they're not on official lockdown yet. So that's what's happening in France and Spain. You can see their numbers are pretty high. Not quite as high as the 3 main hotspots, but pretty high. Then next we have Germany and Norway. And I had to do some research on Norway. Upper left, let's see, that's Merkel, the prime minister, who yesterday announced, or maybe it was the day before, she came out and told, Congress basically that 70% of the German population would be infected. So Germany basically is taking the stance, which is also kind of what's going on in the UK right now, that, it's not, things got too bad too fast to actually start, trying to track people down and see who might be infected. It's easy to do sometime, like Ohio was the last major big state in the United States to get some cases, and 3 people were confirmed, and they came out and said, don't contact us. We'll contact you if these people came in contact with you, because 2 of those people were on a flight, just came home from Italy, and 1 person was on a flight to Washington D.C. So they know who was on the plane with them, and they know all the people that came into contact with them. So when you have a really small case like that, you can do that. You can investigate and see who people came in contact with. But you can't do that, once you get as bad as Germany or the United States or Spain or France, So, sorry, I left the middle one in German. I'm fluent in German, but this is pretty easy to understand. What the world can learn from South Korea. So this is an article about, again, South Korea, which is the model that we should be using, South Korea. Upper right, Norway says no to international travelers coming out of Forbes today. So Norway basically, the whole country is locked down. For the next 2 weeks, kindergarten, schools, colleges, and universities are closed. All restaurants are closed, with the exception of those who can keep patrons 1 meter apart. That's kind of interesting. I don't know how you keep people 1 meter apart. If they're wearing masks when they come in and leave the restaurant, that's probably okay to be within 1 meter if you open a door and somebody's exiting. But, when you're eating, if you're 1 meter apart from someone else, that's a pretty small distance, but that's their rule right now. Buffets are not allowed. Culture events, sporting fixtures, most bars and pubs, swimming pools are all closed. Tourist attractions are closed, including ski resorts and museums. So that's what's going on with Norway now. Norway, getting up there, 598 to 702. Then we go to the US of A, and I don't know how accurate this number is. I refreshed it just before I took this screen print. So this is from 311 yesterday. Today the cases are up from 1281 to 1663, and deaths are up from 36 to 40. So we went from 1281 to 663, from yesterday and today. And the biggest, epicenter in the United States is, first of all the big areas. And, I'm making another video just to question why the CDC is, a bunch of crack smoking morons that don't know how to do anything. These big epicenters here, Seattle, San Francisco, LA, New York, Boston, those are the top 5 U.S. cities as far as population density or population of Chinese people. And like I said, it's not get down on China Day. If all these were, coming from Germany, we'd be looking where the big epicenter, where the big populations of German people are. It's no surprise that, infections pop up in China. That's where all viruses come from. And it's not a surprise when you have big populations, going home to visit China and coming back and bringing the sickness here. The first person to get coronavirus in the United States was in Seattle. Then they started popping up in the San Francisco Bay Area and Los Angeles. Los Angeles still hasn't hit really the uh, San Gabriel Valley, which is goes 30 or 40 miles east of Los Angeles, and it's all Asian little communities there. Nothing's coming out of there yet. Then what do we have in the U.S.? This is starting to see some schools and theme parks and events shut down. But this is not a national mandate that all this stuff shuts down. We're doing things piecemeal. But the most important story here, even though the headline says Americans face dramatic limits on public life, schools, theme parks, and events, is the picture, the photo. Because here, this is in San Francisco, where they're actually following the Korean model, taking people's temperature in a car, checking people, in cars. So that's something South Korea introduced to the world. Hey, we're going to set up this, little road stand where we can check people driving by. Then, Time says, why is it so hard to get coronavirus testing right now? This is a crazy story. Supposedly the problem's over with now, but it's already too late. This is Biogen. Biogen is a huge tech company, biotech company. And they had some people that tested positive for COVID-19, and then they wanted to go to hospitals and get tested, and they were turned away. Why? Because the CDC had criteria that said, we're not going to test anybody unless you've been to Wuhan. They smoke crack, and they say, what kind of rule, what kind of regulations should we set up? What kind of criteria should we set up? We don't have many test kits, and those that we do have are screwed up because we're idiots. So let's say, we can't test anybody unless you've been to Wuhan. Biogen, a biotech company, they're exposed to the virus. They want to know who else is infected, and they can't get a test because of pure crack abuse. No other reason for it. So 2 weeks after the meeting, 77 of Massachusetts' 95 confirmed cases are Biogen employees. Really, you should line up the CDC and just start shooting people. These are medical professionals. I could replace this entire organization tomorrow, and the U.S. would be in a better place the next day, okay? Because I'm not an idiot. I don't sit around smoking crack. America's shamefully slow coronavirus testing threatens all of us. So now, on the bottom of that Time article, it says doctors can now order tests for any patient using their best judgment. Still, the U.S. lags behind other countries. We're lagging behind because the number of tests is just ridiculous that we're now starting to test people. And we let a whole company get infected here, because we couldn't test them. Okay, the Johns Hopkins graph has been whacked up for, a couple of weeks now. Nobody's working on it. I wrote to them. I know some people at Johns Hopkins because I work there. But you can see what's happening to the American cases. We went from 16 cases on 2/21, crossed 100 on 3/2. And lately it's just been going crazy. It looks a little better because from 547 to 607 to 971, that was kind of like an exponential increase, and then then maybe a geometric increase, and now it kind of looks linear, arithmetic increase. So maybe you can predict what's going to happen tomorrow.